I gotta delete that. Good morning, everyone. Come on in.
Morning, Christy. This is Joyce.
Good morning. All right, I'm gonna wait a few more seconds to allow folks to connect their audio. Thank you guys so much for joining us. All right, we have a few more people that were popping in. All right, we'll go ahead and get started. Good morning, everyone. I'm Christy Goldwire, the Director of Program Operations here for the Children's Trust of Alachua County. I'll start by allowing the CTAC staff to introduce themselves. And then Anna, if you can introduce yourself as well. And then I'll go over a couple things before I turn it over to DCF. Yeah.
I'm sorry. Good morning, everyone. We are Corvallis Contract Manager here at Children's Trust. Welcome this morning.
Good morning, everyone. My name is Belinda James, and I am also a contract manager here at Trust. Good morning.
Good morning, everybody. This is Anna Delernia. I'm a consultant with the Children's Trust, helping to support the collaborative.
All right, so today we are excited about having a representative from the Department of Children and Families. The purpose of today's training is to go through the DCF licensing process, the licensing exemption process. Also, you'll have an opportunity to ask questions about that process and what it looks like, the different steps, what the requirements are. So we're excited to be able to offer this opportunity to you all. And I am now going to turn it over to Eva and allow her to introduce herself.
Good morning, everyone. I am Eva Jala, the licensing supervisor for the Alachua area. I also do the Lake City area. I'm glad to be a part of this discussion. Training, and I say this to say that I'm trying to streamline it so that you are not overwhelmed with the process. It's not that difficult. It's just several steps involved in it. But at the end of the day, it goes quickly, it's effortless, and I know I say that loosely because depending on the other city entities you have to interface with, that may sometimes prolong the process, but the process within itself is not difficult. But I'm going to hit the exemption part of it first because that is quick. Licensing exemption. The determination is made by the program office in Tallahassee. We do not do that locally. But if you're going to remember anything about the exemption process, is that at the beginning when you decide, okay, I want to be license exempted. And this is where DCF does not have to come and do inspections with you routinely. You are exempted from licensure. We do not do oversight. The only time we will show up, if somebody call us with a background screening issue, then we will show up and deal with you not having your staff or yourself background screened. But other than that, we don't get involved with licensed exempt people. Now, you can have religious exemption. The religious exemption is pretty much facilities that are ran by churches. And in order to obtain the religious exemption, they have to tap into one of the regulatory bodies within the religious community. And we have several of them in the state of Florida. They will be responsible for giving you the certification. They will be responsible for monitoring you. And again, the only time we will show up is the background screening issue, because you must have background screening to operate a childcare facility. And the other exemption would be the national membership exemption. That is, you are an umbrella of, say, for example, the Boys and Girls Club, the YMCA, those kinds of national organizations that have been doing things for children and family over the years and have that national designation. If you are a member of that, then you show the documentation to say, yes, I am an affiliate of the national organization. Then the program office will give you that exemption for licensure. Any question on that? Okay. Looks like we're going fine. We're doing fine. Now for license.
I have a question. So you said that, for my question is, I operate a community center. So would a community center fall under the same premise as a child care, or how does that affect us for licensure?
Community center. Now, if your community center is just one of those, what I would call a social setting, where the children come and go at will. They don't require adult supervision. In that case, you may not need licensure. However, the final determination will be made if you complete the licensing survey, and sometimes we will call it the licensing questionnaire. And then in that survey, you will outline your activities at this program. And then it goes to the program office. They review what you're doing with the children and how the program is organized. And then based on that, they will send you a letter to say you do not require licensure, you do not meet the requirement for licensure, and then you are exempted.
And where do you find that questionnaire?
On our website, the DCF website. And good question. Everything you need to know about childcare licensing, you go to www.myflfamilies.com/childcare. And it will have all that information. Look for licensing survey or licensing questionnaire. We use that term interchangeably, and can't remember quite how, but I want to think it is survey on there. And just complete that, and the email address to send the questionnaire to is in the document. So just email it to them and they will review it, email you back a response, and follow that up with a letter.
Thank you very much. Thank you.
You're welcome.
This is Christy. I just want to follow up with that. So just so that everyone knows, you will still need to have some type of determination for CTAC funding. And also, if you are planning to offer after school, even though you may be in a different type of facility, there will still be requirements within many of the CTAC RFPs that require either licensing or to be able to show your exempt certificate through DCF.
Now, may I ask, what is CTAC?
The Children's Trust of Alachua County.
Oh, okay, gotcha.
And one thing also,
Question. Oh, sorry.
I just was just going to mention that we learned from the Early Learning Coalition as well that they heavily rely on the DCF certification for you to qualify for that additional money and contracting. So also consider that as an extra bonus.
So as a church, even you're not just automatically exempt, you have to get a letter of exemption.
Correct.
Okay,
Correct.
thank you.
Mhm.
We have
Any
a-
other?
There's a question in the chat about summer only programs.
Uh-huh.
Are summer programs exempt?
It all depends what you're doing. Now, if you're doing a summer camp for school agers, yes, it is exempt. Because that's a summer camp program for school agers. But
And they,
if you are, but
they
if
also have to submit the paperwork as well, or no?
yes, you do the survey, send the survey to the program office and tell them what you're doing.
Got
Now, if you're gonna include some preschool children, and that is children under 5, there's a possibility that you will have to be licensed.
Can you explain the definition of child? Oops, sorry, I don't know if you heard my full question. Can you explain the definition of childcare?
Childcare is caring for children birth through 5. Those children who are under the direct supervision of adults who are not their parents. In a gist, that is childcare. So you may say, for example, oh, I'm just doing enrichment. We're just gonna have the children come in, do music or something. If the parents are bringing those children and dropping them off and leaving the site and leaving the children in your care, that is child. Then you have to be licensed. Simple enough? Any other question?
I have a question. I'm sorry.
Go ahead, Jennifer.
If the parents remain on site, like say the parents are in another program on site and you're providing enrichment activities for children, if they're under 5, you're required to have licensing. Is that correct? I just want to make sure I understand that.
Yes and no. Now, if the parents, for example, we have like the YMCA, parents in the exercise class while the children in another class doing some enrichment activity. You don't require licensure. However, in order to have that establishment, and part of it is the licensing department is trying to keep track of who's doing what. Before you start to do that, complete the survey and send it to us and say, this is what I'm going to do. And then we will send you the written notice or notification to say, okay, yes, you do not require licensure.
But that's only for 5 and under. If the children are 6 and above and the parents are on site, licensing is not required.
It's not required. Even when the children are younger, again, it depends. And that's why I keep reiterating, complete the form and tell us what you're going to do. And then we will determine from there, because I don't want to give the blanket response to say, yes, if the 5 or older, you don't require licensure, or if the younger than 5, you require licensure, because there are some circumstances that will exempt you. But complete that form and send it to us and say, okay, we're going to be providing enrichment activities for these children, but parents will be on site where we can reach the parent, immediately to come and get the children, or they can come in and, supervise, things like that. Let us know, and then we will tell you so you know for sure what it is that you are doing.
There is a question in the chat, and then Leah's hand is up as well, and then Deidre. The question in the chat is, as a drop-in program, will we need an exemption certificate? And Joyce, if you need to unmute yourself to clarify that for her, you can.
Okay, I was kind of asking you, Christy, will the trust require us to have an exempt certificate? I don't think, I think we're exempt through DFC, but I don't know if you're going to require us to have a certificate.
I'm sorry, I didn't realize, I thought you were asking that of her. So yes, the trust will require you to have some type of determination.
And I guess need to ask, are drop-ins exempt?
It depends on how the program is structured.
We just go in for a few hours and come back out again.
Yeah, are you providing supervision for these children where the parents dropping them off and leaving them in
No,
your care?
they're being supervised by the facility that we're visiting. We just go in, offer a program, an extra curriculum program to the children. They're being supervised by people they are supervised all day.
Then you fall under the enrichment provider category, because you're not caring for the children. You're just showing up there and doing what you need to do with them. In that case, the children are under the supervision of that facility. Right. And you just showing up as an enrichment provider to perform a duty for them. So no, you will not.
But Christy's saying that the Children's Trust is going to require us to have an exemption. So should I go online and get an exemption from you that I can provide to the Children's Trust?
So there's a difference between a drop-in and an enrichment provider. So when, as a drop-in program, Joyce, to the trust, that is, children are dropping into a facility that you have. So right. Your question as a drop-in, that's how I answered that question. As a provider going to a different organization to provide extended learning opportunity, then as Eva just said, the children are under the supervision of that organization.
Right. So back to my question to you, Christy, will the trust need us to have an exemption?
If you are providing an extended learning opportunity for a different organization, I believe the answer is no. If you are a drop-in, meaning children are coming to your organization, then there would be some determination that is needed.
No, I misspoke then, because I was under the impression we were drop-ins, but we're not. We're the enrichment provider. We just go in, provide some extra curriculum, and come back out again.
Eva, I have a question. Could you address, I believe the questionnaire, you have to fill it out multiple times if you have more than one site. Is that correct?
Yes and no. If you are doing different activities at different sites, then yeah, you have to do multiple surveys. But if the program is doing the same thing across the board, you can just list the various addresses on that questionnaire and let us know that this is the activities that we're going to be doing at all of the sites.
Got it. Okay.
So I still don't know. Do we still need to fill out the questionnaire to get an exemption?
Joyce, I don't believe so, but we can take it off.
For an enrichment provider, where you just going to show up to a facility that is already either licensed or exempted, and you just go in there to offer a service to them, you do not need to do anything with us.
Okay,
Your relationship is between you and that licensed provider or that exempted provider.
okay. Thank you very much.
Uh-huh.
Lisa,
Are we
do you
good?
have a question?
Did that answer both of our questions, Christy? I mean, the trust won't require us to have that exemption. Is that right?
Okay. Are you talking to me or talking to?
I was talking to Christy. I'm sorry.
Oh,
I'm sorry, Joyce, what was your question?
With what she just said, does that make us okay that we don't have to have an exemption for the trust? She
That
said
is
we're exempt, we're not required to do the survey, all that. So I'm assuming that makes us,
I believe Eva and I are saying the same thing.
right.
okay. All right. Thank you both.
Okay.
You're
Leah,
welcome.
did you have a question? Your hand was up earlier.
No, I'm sorry. That was the church question and I just forgot to put it down. My apologies.
No problem. Deidre, do you have a question for Eva?
Yes, ma'am. Thank you. I'm really confused. I heard yes and no. So with a fitness program, I think I heard you say, and this is just for clarification, with any type of program that has different activities or maybe visiting different sites. So for example, say for instance, I have fitness opportunities and programs that are available, but I don't necessarily yet have a brick and mortar facility for the children to come to that facility. If I go to another facility to conduct these trainings, I think I heard someone say that you have to have multiple certifications, or I'm confused because I heard yes and no, and that's confusing for me as far as implementing a fitness program that's going to have a variety of activities, but not necessarily a particular building at this particular moment in time. So I'm a little confused.
All right, here it is. Consider yourself an enrichment provider. Now you go to a daycare and you say to the daycare, I am a fitness provider and I will like for you to give me an opportunity to come in once a week for an hour or for 45 minutes to do fitness with the children. You do not need to do anything with the department. That relationship is between you and that provider, and perhaps maybe the parents, if the parents will be responsible for paying the fees for that extracurricular activity. So now you go to that center, the teachers and the directors in that center are the people responsible for those children. You are not. So you will be under the supervision of the teachers and the director of that center. Now, if you had your own center where the children were coming to you for these activities, then you would need to complete the survey and tell us exactly how your program is going to be structured. And then based on the information you tell us, then we will tell you, you need to be licensed or not.
Okay, with that being understood, say for instance, I wanted to take the kids on like where we do outside workouts. Now, would the parents have to be present for that? Would I just have to be licensed to make sure that they're supervised? Of course, I'll be there. How does that work?
Now, when you say take the children outside, say you go to the facility and then you want to take the group of children you're working with on the outside of the facility, like on the playground of the facility to do your workout. You are still under the supervision of that facility. So the teachers who are responsible for those children will be around monitoring you and the children while you do your fitness program with them.
Okay, perfect. Thank you.
You're welcome. Anybody else? Okay. Now we go to licensing requirement. In order to be licensed in the state of Florida to do child care, you must have 40 hours of child care introductory training. You must have a person who is responsible for the center to have a staff credential and a director's credential. Now, the staff credential, you can obtain a staff credential by doing additional training to get the staff credential, or if you have a college degree that has something to do with some kind of social science or early childhood development, you can send your transcript, your college transcript, to our training region, and they will assess the transcript. If your training meets that requirement, they will issue you the staff credential. Now, director's credential, I believe, is 36 additional hours of training you have to do. And you have to do some kind of internship somewhere, and I'm calling it internship, but you have to be involved with some child care aspect, hands-on experience. They have various entities that provide the director's credential training. Once that training is completed with that entity, your training certificate will be sent to the program office, who will then evaluate that and issue you the director's credential and put that on your DCF transcript. So that's the first thing. You must have your 40 hours of introductory training, the person who is going to be in charge of the facility. They must have staff credential and a director's credential in order to open a child care facility. You must, of course, have background clearance. We do all of the background screening right now in the clearinghouse that is handled by the Healthcare Administration. And I think they do generally all the human services background screenings. You must have background screening. Now, in the operation of the facility, all of your staff must also have 40 hours of childcare training. Now, if you're opening a facility, your staff who have never worked in childcare, you can hire them to start work, but they must start their childcare training within 90 days from the date they start working. And they must complete that training within a year of their employment. The 40 hours training, you can do that either online or you can do that in a class setting. However, whichever method you choose to do, you must show up in person and complete the assessment exam. And you have to successfully complete the assessment exam in order to get credit for the course. Now, the fee Uh-huh.
There are two questions about that. One question is from Shonda May. Shonda, if you will unmute yourself so you can ask your question. And then after that, Latoya from Just for Us.
Hey, I'm sorry. So this DCF credentialing licenses does not apply if we are going to target students age 13 and up, correct?
What are my target students?
If we're only going to have students in our program that's 13 and up, between 13 and 18, well, 13 and 17.
If it is a licensed program, yes, you have to have the training.
Okay, thank you.
Uh-huh. Next question.
Good morning. So my question is, I've done the survey. I've actually spoken to my Electrical County contact here. I was instructed to go to application for a license to operate a school-age child care facility. And those requirements are different than opening up a child like a daycare center. I was instructed to go to the application that says license to operate a school-age child care facility.
Mm-hmm.
And when you go through that process, that process is different than opening up the child care. I mean, I used to own a child care center, so I have those things you're speaking of. But when I went, after I did the questionnaire, and then I spoke to someone from your office and I got my contact here, I can't think of her name. My application process took me to do school age child care. And when you look at that process, it's not the same requirements as opening up the daycare, like a daycare center. So it's kind
of for a school age facility, the only thing that you do not require is the staff credential, but you have to have the 40 hours training, but you have different classes that you may have to do, for example, like the school age specific training.
Right.
You will have to do that.
Right.
But you still have to have the training, and you still have to, do the same things to be licensed. Did I just confuse you?
Kind of, sort of. I mean, like I said, I have the 40 hours, so maybe that's why she didn't discuss that with me. But when you look at the school age, because what happened was I actually started filling out the child care facility application first, and I realized it was asking me questions. So when I circled back and spoke to her and went back to the website and printed out the school age child care facility, which is like after school programs and summer camps per se, or after school, the applications are kind of different. And some of the requirements are not the same.
Well, the application itself, there's a slight variation to the two applications, but the process remains the same. You know what I'm saying? Because for example, if you're doing a preschool, we're going to require you to have cribs in the facility. But if you're doing school ages, we're not going to require you to have cribs in there. But the same safety measure has to be in place.
Okay, so after doing this, so the correct application to fill out for what we're discussing on this call is the school age child care facility, correct? That's the right application.
I was doing licensing in general first. And then if you have specific with the school age, and which is pretty much the same, the only thing with the school age program, you are dealing with the older children, but you still have to keep them safe, and the ratio, staff to children ratio is a little higher than if you're doing a preschool. But you have to have your training, your background, screening, a safe facility where you can keep the children safely, supervised while they're in your care, provide some kind of not necessarily assist them, but give them the opportunity when they come from school to either do homework and things like that.
Right.
But, you know, again, it depends on what the structure of the program.
Okay, so let me get clarification. So once you do the overview thing and you find out you're not exempt, then you have to do the license. So it's a process to apply for the license, and then it's another process to apply for the school age program. It's 2 licenses.
It's the same thing. Depending on your program, you will indicate that by the kind of application you submit to us.
Okay.
Yeah.
Okay.
You get the process is different from the actual application. The actual application document.
Okay.
Okay.
So since I did the thing, and my next direction was to print this out and fill the operating school age, that's the right next step, correct? Like there is no middle step of like applying for just general license and then you go back in and apply for a specialty program. It's nothing like that. It's just one set of licenses. So my next step would be to apply for the school age care license, correct?
Yes, ma'am. If you're gonna be
Okay.
doing on a school age program, meaning that the children gonna come to you after school.
Yes,
and
ma'am.
you're gonna keep them in your care until the parents get off work or whatever the company.
Yes, ma'am.
Right.
Okay. All right. Thank you.
You're welcome. Any other questions?
Eva, I have a question. So for Girls Place, it took us about 3 months to get licensed, and it, in my opinion, it was because your team here locally worked really, really hard for us. Is 3 months typical, or what's the typical time frame from? And I'm just measuring it based on when a liaison from DCF came out and acknowledged the things that we needed to do to be licensed. To actually getting our license was 3 months.
3 months is typical, and sometimes it can be less. From our end, is dependent upon when we receive all the required documents. And that's why I said from the beginning, it's easy, but when you have to deal with other agencies, sometimes that prolongs the process. For example, in order to license your building, you have to have zoning, you have to have fire inspection. If you have septic tank or well water, you have to have the health department come out. And sometimes those processes take a little longer time because the fire department may come out and see some things that needs to be fixed. And you may not readily be able to get a contractor to come out and get those things fixed. Sometimes those are the things that prolong the process. But from our end, usually, because we try to move the application as we get them. Once we receive the packet and it has all the requirement in that packet, less than 2 weeks, you can be licensed. But it's getting to that point that usually takes the time to do that. And so sometimes we will advise people, don't submit an application to us until you get all of these things done. Because by statute, we have to act on your application within 90 days of receipt of that application. So now when that 90 day comes and you have not gotten your fire or your zoning, or you have not gotten your credential for your directorship, or you don't have a credential person in place, and now you have to go work on that. That kind of delays the process. So it's the other activities that kind of takes long, and sometimes it takes up until that 90 days for most people. Does that answer your question? Good. Any other question?
I have another question. So on your application, if you go on as school age only, but through the process you become a school readiness program, do you just update that application, or how does that work?
No, actually the school readiness designation has to do with the ELC, the Early Learning Coalition.
Oh, okay.
The Early Learning Coalition is the manager of that school readiness designation.
Okay.
So
so
once,
okay.
once you become licensed, then you contact the ELC and apply for school readiness. And they have their own guidelines that must be in place or requirements that must be in place in order for them to issue the contract. The only thing they do is they review our inspections to make sure that you are in compliance with some of the standards that they require to be in compliance on the inspections.
Okay, thank you.
You're welcome.
There's a question from Dion.
Hi, Eva, can you kind of talk to those about, because Christy from Girls Place brought up a good example about directors getting licensed and the process outside of DCF where they have to go take courses at a college. Can you go through that process for those who have not done that?
Are you talking, did you say you want to know how to get the director's credential?
Yeah, there's a separate process outside of DCF where they have to enroll at a college to get some courses done as well.
Oh, yes, yes, sir. For the Alachua area, the Daytona State College is the entity that is contracted with the state to manage the training program, and they govern the Alachua area. Now, they have several entities, and that I don't know, because I just refer, people asking questions about director's credential to them so that they will tell you exactly what you need to, because, policy changes with each agency. And want to make sure you are getting the accurate information. But yes, you have to go to a college, and sometimes the colleges may have sub locations in the community where you can meet to do the classes. And then once you have completed the classes and their requirement, they will issue you the documentation that is required for you to submit to DCF to demonstrate that you have met all the requirements for the director's credentialing. So that's not a process that I'm quite familiar with because we don't deal with that. But in part, I would say this: you must have your 40 hours and you must have your staff credential in order to do the director's credential training. And as I said previously, if you already have a college degree, the college degree can be assessed, and most likely you can get a staff credential based on education. Does that answer your question? Hello?
He said yes.
Yes, I just wanted to make sure
Okay.
other guys heard that.
Yeah, okay. Because you can reach me and I can always give you the contact for the liaison at the state college, and she is more than willing to work with everyone to get you to that place when you get ready to get your director's credential or want to work with your director's credential. Now, let me add this caveat. If you are opening a facility and you yourself don't have your director's credential, you can always hire somebody who has the credential. Our only requirement is that somebody must have the director's credential, so it doesn't necessarily have to be the owner of the center. It can be a staff person who you have put in a position to do that. Okay. All right, so we talked about licensure, That is getting your zoning, getting your fire inspection, getting your background screening in place. Now, background screening, as of, when was this? I think 2 or 3 months ago, we went to an online application process. We're still working on fine tuning that. But once you go online and you submit your application online, it would then generate the OCN number for you. And the OCN number is your identifier in the clearinghouse for background screening. And every facility must have an OCN number in order to submit excuse me, I'm trying to silence this. In order to have your background screening submitted in the clearinghouse. So always pay attention when you submit application online to capture that information in order to be able to get your background screening process. Adam Joy, that name looks familiar. And then the health department, if you have if you have septic tank, or if you're doing well water, we need the health department to come out and test your water if it is well water. If you're on septic, they need to come and assess your septic tank and give you a capacity that can operate in the facility on the size of the septic tank. You're also gonna need some of your staff in the building who have first aid and CPR certification. As of December, we're gonna require at least 3 persons in the facility with first aid and CPR. I always recommend to providers that it's always best to have all of your staff have the first aid and CPR certification, so that in the event, somebody needs to leave. For example, if I'm the only one in the building with a first aid and CPR certification, if I have to leave or don't show up to work that day, now the center is out of compliance because your only person who was certified is not in the building. So it's always recommended. And with where we're going now, with needing to have, in some cases, every class having a certified person in our class, it's just best to have everybody certified, so you're not concerned or worried about somebody not being available. Now, I know we touched on the training a little bit, and one of the things that Christy asked for clarification was the cost of training. This is the DCF training now, and I'm sure there's additional costs with the staff credential and the director's credential that we now party to. It depends on what agency you're using. That cost will vary. And also, it's the same for background screening. Background screening, we have different vendors that actually do the fingerprinting itself, and depending on who's in your area, the fee may vary. We are hearing as it varies from anywhere from $60-something to $150, depending on where you are. But again, when you get in the clearinghouse and you sign up or set up your account for fingerprinting, they will give you a list of vendors in your area who are connected to the clearinghouse that does fingerprinting, and you must go to one of those vendors. Don't just go to the substation, because I know years ago, that's how we did it. We send people to the substation to go get fingerprinting done. We no longer do that. So you can't just go anywhere that does fingerprinting. You have to go to one of the vendors that's on the list so that they can be able to submit that print to the clearinghouse for evaluation. For the exams on all of the DCF classes, online classes is $10 each for the course itself, for the studying of the course. But if you're going to take the exam, it's $1 per credit. So for example, if you're doing a course that has 4 credits, then it will be $4 to take the exam for that course. Okay. Any question on that? Did Adam Joy have a question? I see his name popping on my screen.
I think he had put a comment in the chat.
Oh, okay. I'm not going to try. All righty. Okay. Submitting your application to us after you have gotten all these other things, your training, your director's credential, background screening, your zoning, fire, health department, if it is applicable. You submit an application to us and you include all of that document with the application. Part of the background screening, there's the abuse and neglect form that needs to be acknowledged. So you sign that and make that a part of it. And usually, once you submit an application online and we see the application, we will reach out to you. Most cases, we will email you a packet. And in that packet, it will have all of the documents it's supposed to have in there, except for those documents that you have to generate and send to us. So you fill all that up and send us the hard copy, because the goal is that we will be able to retrieve all of that from the online application, but we are not quite there yet. So we're still doing it as we have been doing it previously. So you will send that packet to us. You can mail it to us, or you can email it to us, and that's fine. We will work from that. In that packet, you must include your floor plan. The floor plan can either be your drawing, get a sheet of paper, draw the layout of your facility. You label each aspect of the layout. For example, this is classroom 1, this is classroom 2 and 3, or so forth, or whatever name you want to give to your classrooms. You put that on there, and you put the measurement on the classroom in that space and send it to us. That's how we determine how many children you can have in each space. It's 35 square feet per child in each space. So once we get that, we will do a rough estimate and say, okay, this is the amount of children that can be in this space, and the amount of teachers that's going to be required. We'll give you a guesstimation as far as the number of staff, because the staff will depend on the ages of the children you have in care. Staff to student ratio varies. Now, when you have the infants, of course, infants it's always going to be 4 infants to 1 teacher. And for the 1-year-olds, it's going to be 6 1-year-olds to 1 teacher. For the 2-year-olds, it's 11 2-year-olds to 1 teacher. And then with the 3, 4, and 5, that you can always do a mixed group of children. And then depending on the largest number of children, they will carry the ratio. For example, if you have 3, 4, 5-year-old mixed together, for the 3-year-olds, capacity is 15. Let me verify that if I tell you wrong. And say the majority of the children in our class are 3-year-olds, then your ratio in our class will fall in the 3-year-old categories. But those are things that, I say to people, wait till when we come out to do the inspection, and then we can discuss that and reiterate it. And again, because I'm one who learned as I'm working through. So if you just throw a bunch of information at me, some of that get lost in transition. So as we walk through, we share the information. Hopefully you get to get a better understanding, a better grip on the information. Always talk to your licensing counselor. The licensing counselors are assigned to zip code, so you will have whatever zip code you in, the counselor assigned to that zip code is your counselor. And once they make contact, you have that information. You always call them if you need specific clarification on something.
Eva, were
Yes.
you able, and I'm not, if I missed this, I apologize, but since these are providers that are working with older children, can you talk a little bit more about the ratio for older children?
Okay, older children, I know with the school ages you can have. And I want to make sure I give you the right information here. So school ages, we're talking about 5 and older. The ratio for that is 25 children to 1 staff. Now, I say that to say, know your children. Because 25 5 and up children in the group, depending on where those children are, they can be a handful. So know your children and know that you may require to have more staff in our group. But for licensing purposes, 25 children to 1 staff is what is required. Okay.
I have a question, Ms. Eva. With regard to, and so I have some specific questions, but when you're talking about the DCF licensure, we operate a family resource center, so there's a lot of different programs going on. We're licensing the program only, not the center itself, if that makes sense.
Correct.
Okay, so all the things that you're saying only apply, I mean, a lot of it, background and all that we do for everyone, but these things would be like specific to the after school program. Would these also apply to like family programs and events that we have that are outside of the after school program?
No.
For example, the ratio, okay.
Yeah, the only time, because again, the supervision of the children is what we are concerned with. You just want to structure your license program to where it is not crossing into other programs where other people are having access to these children.
Yes, of course.
Right. So yes, if you have multiple programs on site, just let your licensing counselor know. And then the parameter within which your child care program is being operated, that's the parameter that we are concerned with.
Okay, thank you.
You're welcome. Any other question?
I have a question, Ms. Eva. If you want to talk to someone about the training on your transcripts, do you have a direct contact? Do you just call the Tallahassee number, or do we speak to the local person here?
Transcript is always a Tallahassee issue because they handle that. They have the training department that is responsible for that. The only thing we do on our end is view the transcript to make sure that you have everything that is required to be. As far as editing or adding or removing something, those kinds of things, those are things that's done on the back end, and Tallahassee does that.
Okay, you don't have a number for that, so just go to the website?
Yes, go to the website and that number should be on there. Or that number is 1-888-352-2842.
So you said 1-888-352-2842?
Yeah, 1-888 is 3 8s.
Okay, thank
And
you.
that's 352-2842. You're welcome.
Thank you.
I also have one other question, Ms. Eva.
Uh-huh.
And this is back to the background screening. So I'm sure many other programs do this, but we have some parts of our after school that are operated by internal staff, such as myself or our family support facilitator. And we work for partnerships. So of course we go through the whole DCF background screening and everything, right?
Uh-huh.
Our partner agencies that come on site, say for instance, we bring in a partner agency to provide socio-emotional groups. We'll have like an MOU with them that states that all of their staff that they send on site will have the level 2 background screen. Is that sufficient for you all, or will we then need to show specifically that those persons also have that DCF clearance? Because we normally don't collect that. We just have that in writing through the MOU.
Okay. Now, when they are on site, are they left alone with the children?
A lot of times, yes.
Okay. Then they need to be bringing a copy of their background screening with them.
Okay, but if not,
yeah,
that's part of it. Sometimes, the staff, it allows the provider to operate the program while staff are in the building, but they may not necessarily be in the room. But you're saying if that's the case, then they would have to actually show us that they have that DCF background screen.
Yes.
Okay.
And what we have asked is that, and then those are people we kind of put under the umbrella of enrichment providers.
Yes.
The therapists and things like that. We know that most of the time by their therapeutic licensure, they have to be background screened. We know that. But with everything, you have to have, documentation. So we ask that, yes, as long as that person comes from an agency, you have that documentation, they can just, have their own folder with them and bring it in. Not necessarily leaving it with you, but shoot in case there's a question here, here's my documentation. That's all.
Okay, thank you.
You're welcome. Okay. Back to licensure, we already talked about submitting the application, and we talk about the background screening. We talk about the training, first aid certification as well, and I just talk about the capacity. Now, if you are providing food on site, meaning you are preparing food on site, you have to have a functional kitchen. Your kitchen has to have hot water in there. Your kitchen has to have 3 compartments, sink in addition to a hand washing sink in there. You need to have fire extinguisher in there. The health department, not the health department, excuse me, the fire department also will have something to say about how your kitchen is set up, because I know you require suspensions and some other fire protective mechanism in your kitchen. So the fire department will address that during their fire inspections as well. And usually if the fire department requires something of you, then it must be done in order for us to approve your facility or your kitchen. They are the experts, so we will not override them. We take whatever they say to us as gospel, so to speak. Your building must be kept cool, must be kept warm during the winter time. So your temperature has to be anywhere between 65 degrees and the highest it can be is 82 degrees. We are in Florida. So, we're going to require that you have a way to keep your building cool in the case. If you are doing transportation, your driver must have a physical. Your driver must have first aid CPR training. Now, if your driver is going to be driving children by herself or himself, then that driver must also have their DCF training. Now, if the driver is just driving the bus or the van or the car, but there's another trained staff on the bus, then you're good to go. So the only thing they will require then is their driver's physical and their first aid, CPR, and training. Okay. I just talked about the kitchen, which falls under food services, and of course, your refrigerators must maintain portable thermometer in there, because sometimes the thermometer that comes with the refrigerator may not work as well as it's supposed to. And two, you need to be able to gauge the temperature in your refrigerator. So that's why we require that you must have a portable thermometer in your refrigerator and the freezer. And everything you put in the freezer, if it's not commercially packaged with an expiration date, say for example, you buy a bulk of something and you separate it in individual packages, you need to date it. Write a name of whatever that item is and put a date on it to put in the freezer or refrigerator. Okay. Food expiration date. We go by the date that is stated by the manufacturer on your packaging. Sometimes it depends on what it is, because we've gone back and forth with this question about, well, is it the manufacturer's date or is it if it is still good? So usually we fall back to the manufacturer's date. Any question on that or anything else that I have said? For licensed providers, licenses are renewed once a year around your anniversary of each year. We will usually send you an email somewhere between 60 to 90 days prior to the expiration of your license, reminding you that it's time to submit your application for renewal. We require that that application be sent to the licensing office with the fee payment 45 days prior to the expiration of your license. And the reason why we require that 45 days prior, so that we can work out the kinks that needs to be worked out before that due date. Because if we do not have everything that is required to renew your license prior to the expiration date, and that expiration date show up, your license expired, you no longer have license to operate. You have to start the process over as if you were a new applicant. So always pay attention to that. When you receive the packet, my recommendation, as soon as you receive it, fill it out, put it in the mail. The application will come with an invoice, write your check or your money order, address it to the address that will be on the letter, because the payment goes now to the program office. We used to receive it locally, but we've changed that this year, where it's not centralized into the program office. Send that off. If your application is later than that 45-day window, you're going to receive a fine, and the fine goes up $50 each year that you are late. So if you're late this year, it's $50, next year it's $100. And timeliness means that we receive the payment and the application packet 45 days prior to your expiration date. I think pretty much that's the submission I have for licensing. I will entertain any questions regarding maybe something that I did not touch on. And again, as I said, it's not difficult. It's just, you know, various steps that have to be accomplished. And if you just go through this step-by-step process, is easy, and don't hesitate to call your licensing counselor or even call myself if you have questions along the ways, and we'll try to answer those questions for you. And if we don't know the answer, we'll try to find the answer for you. But it's best for you to get the direct answer from us instead of talking to other providers, because sometimes the information that is shared amongst providers may not necessarily be accurate information, and then we show up and citing you for something you did wrong, and then you say to us, well, so and so down the street said this is what DCF said. You know, we all have different memory, and we hear what we want to hear at the time. And sometimes, you know, and I say that to, and we shall understand, you know, when we show up to somebody's facility, they are anxious because we are there monitoring them. And so sometimes we say some things that they don't quite hear because emotions are so high, you know, and sometimes, you know, they didn't hear what we said or how we said it. But when in doubt and have questions, don't hesitate to call us so that we can clarify those things. Okay. And I will now entertain any question regarding anything that I didn't say or clarify.
All right, the floor is open for additional questions if there are any.
Question. If Ms. Eva, if we have multiple sites that operate after school programs, do we submit an application for licensure for each site individually or under one umbrella?
Oh, no, it's individual because your license number is based on the address. So okay. Each address has a different license number, so you have to submit application for each site.
Okay, thank you.
Going once, going twice.
All right, no more questions. I just have a couple updates for everyone. In a second, Dion will be dropping the sign-in link into the chat. There it is. You should see it now. Also, we will, Eva did provide us with several handouts, and so we will upload those handouts to our Youth Development Capacity Building Collaborative webpage, and then we will send you all a link to that webpage. And so we'll have different handbooks, fact sheets, the director's credential info, and licensing checklists. All of that information will be there for you. Thank you to those who are providing additional details within the chat. That was greatly appreciated. And then as a reminder, the part 2 of the Florida After School Network training has been scheduled for November 11th. I'm sorry, November 4th, 9:30 to 11:30. Thank you. And then if you go to our website, the Children's Trust of Alachua County, the website on our calendar, you will find the link to register to all of the capacity building collaborative training. So that part 2, as well as the monthly meetings. But we'll also include those links in an email to you all when we send you the updated Youth Development Capacity Building Collaborative website. If there are no additional questions, I will take this moment to thank you all for taking the time to join us again. We want to thank Eva for sharing this information with us. We greatly appreciate it. And that is it for today. Thank you, guys.
And let me just add this real quick too. Usually the department does information blast by email. So if you are licensed provider or exempt provider who is in our database or network, email blast will come to you with updated information or changes to our rules and regulation. Please don't dismiss those emails, review them. I know, when you visit taking care of children, it's difficult to, stop and just do all of that, but occasionally just stop, open those emails so that you can get, updated information and keep yourself abreast of changes down the pipes. But it was wonderful chatting with you guys. And as I said, don't hesitate to contact our office if you have individual questions, and then we can walk you through that or refer you to where you need to go to resolve that issue. And thanks everyone for your undivided attention and participation.
Thank you.
Okay. All right. Bye for now.
All right. Bye-bye.